Hello, my name is Luz Gonzalez and I will be presenting you about the respiratory system. I have decided to focus on asthma. I chose this topic because I know many people affected with this disease. Asthma is a condition in which the airways become narrow and blocked, with mucus making it difficult to breathe. Stop. Asthma falls under the study of pathophysiology. It is an inflammatory disorder of the airways, stimulated by triggers. Examples would include allergens, cold weather, family history, dust, air, pollution, occupational factors, drugs, exercises, animals, food, and other factors. Any alignment of the body that disturbs its normal physiological process is the study of pathophysiology. The process involves looking for certain malfunctions that cause or come from disease. The most popular rescue inhaler is called albuterol. It can also be controller inhalers that prevent symptoms, which are made from steroids. Severe cases may require longer-acting inhalers that keep airways open, which are formoterol, salmeterol, tiotropium, as well as oral steroids. Also, a maintenance inhaler is called Quivar. There is also allergy shots that can be administered to certain individuals. If they suffer from allergies, it can help your allergies to calm down and won't affect your asthma from flaring up. There is also inhaler medications that can be delivered by a device called nebulizer treatment, which can be administered in the form of a mist used to treat asthma and other respiratory symptoms. There are also allergy shots that could be administered to certain individuals. If they suffer from allergies, it can help your allergies calm down and won't affect your asthma and will keep it from flaring up. There is also inhalant medication that can be delivered by a device called nebulizer treatment, which can be administered in form of a mist, used to treat asthma and other respiratory conditions. 93% of asthma patients do not use their inhaler correctly, failing to exhale completely before inhaling the medication, inhaling too fast through the spacer device, and not shaking the inhaler bottle before using it again, and the second puff can cause asthma to flare up. 93% of people with asthma do not use their inhaler correctly. Failing to exhale completely before inhaling the medication, inhaling too fast through the spacer device, and not shaking the aerosol inhaler before the second puff does not help with your asthma. Please see details and information for how to use your inhaler properly. These pictures show how the lungs look before and after an asthma attack. On the top, we have an air sac that is healthy. There is room for the air to flow. The bottom one, however, shows that the air sac is very swollen and filled with mucus. It is inflamed, which causes difficulty in breathing and can lead to an asthma attack. According to EPA.gov, 1 out of 10 school-aged children have asthma here in America. However, this condition does not just affect American people. It goes worldwide, affecting millions of people. The National Asthma Council in Australia have found that in 2018, there was 398 deaths because of asthma. The National Asthma Council in Australia have found that in 2018, there was 389 deaths because of asthma. There have also been numerous studies, including the CDC, who have data to prove on average women are more likely to be affected by asthma. But it is Black women who suffer the most. While a white woman is 8.1% likely to have asthma, a Black woman has 10.1% chance. This is much higher than their white female counterpart and male counterpart. CDC has also concluded that 1 in 12 people have asthma, and it continues to increase every year. 1 in 2 people will experience an asthma attack in their life. As CDC also concluded that in 2008, 3,447 people in the U.S. had died because of asthma. That is 9 people per day. It is costing the U.S. about $56 billion in medical costs, lost in work days and school days, and even deaths. A new study shows that teenagers who stay up late are more likely to develop asthma than those who sleep in early. The study was developed in India by Dr. Subhara Motera at the University of Alberta in Canada, who carried out the research. She stated sleep and the sleep hormone melatonin are known to influence asthma, so she wanted to see if adolescents' preference for staying up late or going to bed early could be involved in their asthma risk. Researchers found that the chance of having asthma was around 3 times more in teens who prefer to sleep later compared to those who prefer to sleep earlier. This is the first study to examine the possible role of different sleep preferences in teenagers' risk of asthma. This shows that parents and guardians should really continue to encourage their teens to sleep in earlier to prevent asthma. If asthma is left untreated, then that can cause many problems, like an asthma attack and even hospitalization. Once asthma symptoms get worse due to the tightening of muscles around the airways, then a person should quickly seek medical treatment. On July 13, 2020, Teva announced the first ever digital quick-relief albuterol inhaler that uses technology to help with asthma management. It is the first and only digital rescue inhaler with built-in sensors and Bluetooth now available in the U.S. by prescription. There was also a mobile app created with the inhaler to help manage your asthma. This mobile app, now available on iTunes, helps control asthma management. It includes many things, like track when you use your inhaler, when you need to take it, and a bunch of data and records saved to your app. The Pro Air Digihaler was approved by the FDA back in December in 2008 and is set to cost $146.64. Brandon O'Gary, who is the Executive Vice President of the Teva Pharmaceuticals, stated, "We are especially proud to provide our first ever Digihaler product at a time when digital health technology is growing and continues to transform patient care, since it will enable patients to electronically record and monitor their rescue inhaler use." There are many devices that you can keep at home to help with asthma management. One of these devices is a peak flow meter, which monitors the peak expiratory flow rate of air by just simply blowing on the device. For emergency situations only, an EpiPen can be used as a receptor activation. There are many ways to stay in control of your asthma. The first one would include stay on top of your vaccines. The second one includes take asthma meds regularly if prescribed. The third one would be aware of your breathing and seek medical attention when needed. The fourth one would be make sure your lungs are in great shape by visiting your doctor yearly. In 2019, research by the CDC has concluded that people with chronic lung diseases, including asthma, have higher risk for contracting COVID-19. People with asthma at this time should take care of themselves and seek medical attention if needed. It is important to take care of your health in order to prevent the disease. This last slide shows all my works cited for this presentation.